Everyone that comes in gets a posture check. Now, it may have been a while since you had yours, and we might not have even talked about everything that's on there, but what I want you to do is just pull it out and look at it if you have it. But if you don't, here is a quick thing. So we're gonna start like this. We take two pictures with every posture picture. One is from the side. Patient's gonna be looking straight ahead. I'm looking at ear, shoulder, hips, all this alignment from this angle, right? The other one is gonna be straightforward. So with this one, we're looking for any head tilt, shoulder tilt, what are the hips doing, those kinds of things, right? The two biggest areas that I see that are problematic. With this one, I will see hands turned in, right? I don't want to see knuckles. With this particular straight on, we only want to see thumb, index finger. Once we start to see knuckles, that's usually coming from the shoulders. So you have issues, this leaves the rotator cuff, very vulnerable to injury, things like that. It can even change how the elbow works if you're working on a computer, using that mouse a lot. Now, the other one that I see most common is gonna be from the side. See, there we go. This, once the ear starts coming out, it puts so much pressure on neck, shoulders, all this stuff. Now you combine these two and look at this. She looks like she's working on a computer all day. So what we want to do is really work to reverse all of these processes. And then you feel better.